The weight management program is another big part of my practice that I've been doing since the 1980s or so, very long time. Because weight issues are a major issue for many internal medicine problems like diabetes, hypertension, heart disease, the big three, and some cancers too are related to weight, such as colon cancer and uterine cancer. Obesity puts people at much higher risk for developing those types of cancer. So weight management is a major aspect of my practice, and I try to bring that up even when people come in for physicals. In our weight management program, we offer an individualized approach based on a patient's health history, previous diet experience, if any, and overall goals. The entire program is designed to support overall lifestyle changes such as exercise, behavior modification, stress reduction, and proper sleep. Finally, in order to maintain your new healthy lifestyle, we offer continued patient education, support, and medical supervision.
Because I ballooned up to 327 pounds, and she was with me all the way, trying her best to put me on every possible program that she could put me on. She recommended years ago that I consider having surgery, but I didn't want to do that at the time. But years later, I listened with both ears and started really getting some information about gastric bypass surgery, and with her blessings, I had gastric bypass surgery. But I needed a physician to monitor me and help me through this, and she did all of that. She helped me watch my diet, she helped me choose what I was going to eat and not eat, and she helped make sure that I was responsible in the sense that I knew that each time I came to visit her, if I had put on a pound, I'd have to explain it. And if I was the same weight, I'd have to make sure that that was okay too. But she was never cruel at any time or made me feel uncomfortable at any time. She always treated me so nicely. I came into this knowing a lot. It's just that I wasn't paying attention to what I needed to do. And it wasn't that my heart didn't want to, it was just that I was out of control. And I think that looking back on it now, I really believe that had she not pushed me like she did, and had things not come along like they did, that I may not even be here today. Start the diet route, because she has lots of different types of diets. It's not just one diet for every person. She evaluates the person and deals with that individual, which is what she did with me, because I don't like some things that are so important on some diets. So I would tell them to start that route. And I lost 184 pounds. Yay. A whole person, that's right. That's exactly right.
Well, I've been on the weight management program for about a month now, and what I really like about it is I don't wake up every morning thinking, what can I eat right away? Because I was like obsessed with food at one point, and it was really bad. And I am taking her shakes as part of the weight management program, supplements, meal replacements that she has. As a matter of fact, I take the chocolate shakes, and they have vanilla shakes, and they're really easy to make. You mix them with water. I take them to work. You put them in your blender. They're really thick and delicious, and she actually has a little like a menu that comes with it. You can add flavorings to it and different things to spice the flavors up. You make it a little more variety. And I've been doing that for about a month now, and I've lost about 10 pounds. And I haven't been hungry the whole time. Also, I'm on an appetite suppressant, which I take a couple of times a day.
The support system that I have is the patients primarily see me at least roughly every 2 weeks. And I spend time going over counseling, dietary counseling, going over their medications, any side effects. We have educational material that we have scanned into a computer that we keep at the nurse's station with dietary information, exercise information, all kinds of articles on behavior modification, just numerous articles that we've accumulated over the years.
We also use mainly the metabolic rate measurement test is one of my areas. So I exclusively do that for them when they come in for their weight management appointment, or if they're just starting brand new It's one of the baseline examinations that we also do. Along with that, we also do an electrocardiograph. We want a resting EKG, mainly because we want to make sure that their heart status, rhythm status, and heart rate will not interfere with a plan of treatment should we need to use suppressants that are prescribed.
Treating the weight, many times we can prevent these problems from occurring, or if they do occur, many times patients can come off their blood pressure medicine, not always, but many times they can, or their diabetes medication, or at least reduce the medication, reduce their risk of complications from diabetes, hypertension, and I think we all know the risk, stroke, heart attack, cancer, etc.
Not a lot of doctors truly really understand weight management. They want to just give you a diet pill that peps you up, and but they genuinely had a nutritionist there that told you and showed you how to measure foods and showed you how to mix the carbohydrates and the proteins and all of that together. It was so wonderfully educating to me. And I love the camaraderie of sitting with other women that might be going through a similar process. I found that to be more appealing to me than going to Weight Watchers or someplace like that, because I really had faith that this was run by real medical people, and it was wonderful.